Hey, everybody. Thanks again for joining us for this exciting announcement. We're really happy you could be here either in person or on the Zoom. Before we get started, just one more reminder. If you are on the Zoom, if you'd mute your microphone right now, we'll have time for questions at the end, and you can unmute then and we'll answer as many questions as y'all have. So let's go ahead and get started. I want to introduce Martina Smith. She's the director of our Division of Provider Services and Quality Assurance, and she's going to share more information. So Martina.
Good morning, and welcome to all of you joining us here today to hear more about this opportunity for Arkansans. I am Martina Smith, Director for the Division of Provider Services and Quality Assurance here at DHS, and I'm joined here today by Deputy Director Sarah Schmidt. We are proud to announce to you today a new program, the Respite Care Pilot Program for those individuals with Alzheimer's and related dementia. This $200,000 program is a wonderful opportunity for those that provide care to those individuals. As we all know, Alzheimer's can have a devastating impact, not only on those that are suffering with the disease, but also for those individuals that are caring for them. It can take a toll on them financially, mentally, physically. And we hope that this program will help. This program took a lot of work and a shared vision, and we are so proud to be here today with the Alzheimer's Association in Alzheimer's Arkansas. The work that was put in to have this program is astounding, and we are proud of that work. We would also like to thank those individuals that support the program. We'd like to thank the Arkansas Legislative Council for supporting this program and approving this program. And we'd like to thank DHS leadership and the staff, because each day we care, we act, and we change lives. Thank you. I'll now present David Cook.
Thank you, Martina, Sarah, and to the leadership of the Department of Human Services, Secretary Gillespie, for all your support and your belief in the shared vision that as we come together in these public-private partnerships, we can create solutions for caregivers who, as Martina mentioned, are facing an enormous burden. We also want to thank the co-chairs of the Alzheimer's and Dementia Advisory Council, Senator Ricky Hill and Representative Julie Mayberry, as well as our partners who serve on the council with us, who are desperately working to provide solutions for caregivers who are, again, carrying the brunt of providing care for those, their family members who are suffering with dementia. Most of all, we know what this funding will mean for the more than 93,000 Arkansans who are currently providing care for persons with Alzheimer's or another form of dementia. The care they provide is often at an unpaid rate. In 2021, we know here in Arkansas, those caregivers provided over 140 million hours of care, often at an unpaid rate. The value of the care they provide saves the state close to $3 billion annually. The caregiving experience for dementia caregivers is intimate and carries with it an emotional toll. The loss of cognitive and physical ability that accompanies dementia leads to a higher level of emotional stress for these caregivers when compared to those caring without the disease. Responsibility of dementia caregiving often falls to women. Nearly 2/3 of dementia caregivers are women. 1 in 4 caregivers are a part of a new caregiving generation called sandwich caregivers. That is, they provide care for their own children and also caring for a parent who might have dementia. As the caregiver population continues to increase here in Arkansas, it is essential that we continue to explore strategies that will increase support services and resources for all those who are affected. We are proud to be here today to announce the first program of its kind here in Arkansas. This Dementia Caregiver Pilot Program will provide respite services that are targeted specifically for caregivers of individuals with dementia. This is a historic day in Arkansas, and we're proud to be here to participate in this program. We're equally excited about the data we're going to be able to collect as we go through the duration of this pilot. We'll be able to see exactly where these services are desperately needed Also do some caregiver analysis to understand what their real needs are, but also be able to target specifically rural parts of the state. Limited funding up to this point has, again, decreased the capacity of where these funds could actually go. A part of this pilot program includes targeted funding to reach our rural parts of our state who are medically underserved. We also, as the Alzheimer's Association, want to remind those who are providing care or impacted by this disease that you're not in this journey alone, that we're here to help you and walk with you through this journey. We have a 24-hour helpline that's available to you, and you can learn more information about this pilot program. You can access that hotline at 1-800-272-3900. To speak more about the parameters of the program, we're proud to partner with our partners, Alzheimer's Arkansas. And I'd like to introduce Carolyn Berry, who will talk to you more about this program.
Thank you, David. I'm Carolyn Berry, the Executive Director of Alzheimer's Arkansas, and this is the grant staff, Amanda Shaw and Ricky Williams. Alzheimer's Arkansas is so grateful to be able to partner and be able to manage this Respite Dementia grant. We will have a number of ways for caregivers to access the grant. The number one way is to go to our website, alzark.org. You can also visit our Facebook page at Alzheimer's Arkansas. Other ways to access the grant will be to go to the Alzheimer's Association, the DHS website, as well as we will partner with the Area Agency on Aging and other stakeholders across the state. Our goal is to make sure, as David said, that rural areas across the state, accessibility has always been an issue, and we want to make sure that we serve the caregivers across the entire state. We will partner and make sure that all caregivers have the respite care needed. Amanda and Ricky will talk about the qualifications and guidelines of the grant.
My name is Amanda Shaw, and I'm the grants coordinator for Alzheimer's Arkansas. We are excited to be able to offer a non-income-based grant to caregivers throughout the state of Arkansas. As far as the details for this grant go, it's going to be a $500 grant that caregivers can apply for up to twice a year, with 6 months in between applications. The patient has to have a diagnosis of any dementia, and they can be of any age. We've committed to providing at least 25% of these funds to rural areas in Arkansas. And as far as the application process goes, the application part is a very simple 2-page application. It also includes a survey to get some information just regarding the ease of finding these funds, how the caregiver wants to use the funds, and just some preliminary data to determine the impact that this money will have on our families in Arkansas. The application will be processed within 10 business days, and whether the application is approved or not, the caregiver will receive some kind of correspondence from our office letting them know the details on how they can use their grant. Applications can be received by going on to the various websites online. Caregivers can also call our office. Our phone number is 501-224-0021, and the grants extension is 210. Caregivers can call, simply request an application be mailed to them, and we can get it out in the mail the same day. Caregivers can request an application via email. Our grants email is grants@alzark.org. And of course, they can also visit our website, alzark.org/grants. And of course, any questions regarding applying, receiving an application, and what to do after they've been approved for a grant can come directly to our grants office, and we are more than happy to help.
Thank you very much.
So now we will have FEMA Lobby, a caregiver story.
Thank you for everyone being here today and all the friends that I have met through my journey. In 2017, my parents were both diagnosed with Alzheimer's. Unmarried at the time, I've moved my dad here in 2017 as well. My father had Lewy body, dementia Lewy body, a more aggressive form of Alzheimer's or dementia, and he passed away November 1st of 2019. My mom has Alzheimer's. She's in the middle stages. Last year, after 25 years of working for a TV station, THV 11, I retired, feeling the calling on my life to be my mother's caregiver full time. My father had the financial means to have 24/7 care. My mother does not. So I am her cheapest and most qualified caregiver. It is a privilege. I want to honor her as she's in this process. It is a journey in which, for sure, I have learned caregivers fatigue, not for myself. I will probably get there, and I am grateful to know that there are grants for respite. But I just, through classes that I've taken through the Alzheimer's Association, through other associations, the fatigue is the thing that had me the most fatigued thinking about, because I could see it on their faces. I could hear it in their stories. The classes were extremely important to take, as well as caregiver groups, support groups. So last year, while I was still working, I started a podcast so that I could talk to other caregivers, be of support to caregivers, called Don't You Remember? And it's been extremely beneficial. It was selfish on my part as well, because I needed to stay connected, especially since I was caring for my mom full time. So I do that. And then I have the privilege and opportunity still to be a guest on THV 11's Divine once a month with support from Alzheimer's Association, with tips for caregivers. So my heart is for caregivers. The one thing that I did learn a lot in the groups was that they feel selfish taking time for themselves, caregivers do. And so one of my hopes is that we can get the word out about this respite and let them know that there is care, that they can take care of themselves as they're caring for a loved one with dementia. So I want to thank you to everyone possible, and sharing the story of my journey with my mom, who is also. Thank you.
Thank you for that. I'm Senator Ricky Hill from Cabot. I kind of want to touch base with you a little bit today, tell you some of the most devastating words you can ever hear in your life. One is, your mother has dementia. That's very touching. You don't know where to go, what to do, who to turn to, and where to proceed with in life, because you know it's a devastating time coming to you. When you hear those words, you have to reflect on what's going on. My mother had it for 10 years. My dad was of the WW2 generation, the greatest generation during that time. He was determined to take care of her at home by himself the entire time. My mother left our house only 2 hours before she passed away, because he was that driven. But that's why they're called the greatest generation. In today's world, it's hard to do, simply because my dad was retired. He could stay home with her. It took 10 years off his life by doing that. But he was determined. In today's world, it's hard to do, because we have families who work. Both parents have to work. And then to take care of your kids, and to take care of a parent, an uncle, an aunt, a friend, someone that needs it. Very devastating, stressful on the family. And odds are the person who takes care of the Alzheimer's patient passes before they do, because they don't take care of themselves. That's something that we've got to take care of. And that's why we're here today, is to try to get a starting point on how we can take care of the caregivers. And with that, we can see success. This is just a starting point. We're way behind other states. And the money that we have appropriated today is a stepping step. We'll go from this point. We've got to go farther than where we are now. simply because that's what we have to do to take care of our elderly. And it's not just elderly people nowadays that's affected. It can be someone in their mid-40s, maybe in their 30s. I have a friend who passed away from it. He contacted it in his late 40s. Lasted 7 years. So it's not just affecting older people nowadays. The age is getting younger for people it's affecting. I will tell you one thing that's most devastating about this disease. Is whenever your mother looks at you and says, "Who are you?" Those words are powerful. You have to step back and think, I'm here to take care of my mother, not the person that's here now. Because that's what life's about, taking care of each other. That being said, I want to pass on to Ms. Julie Mayberry, Representative Julie Mayberry, to continue on.
Exciting news being revealed today. I want you all to think about when you get on a plane and what happens when you get on that plane. A flight attendant comes forward and they start telling you this life-saving information. And they tell you about these masks that are going to come down that have oxygen. And what do they tell you first? They tell you to put it on. Whoops. Sorry. How that was on there. Here we go. Okay, let me back up a little bit. So the flight attendant says to put that mask on you first. Why do they tell you to put the mask on you first? Because you need the oxygen and you need that life-saving medical equipment so that you can help take care of someone else. I believe that that's what this respite grant is. It is that life-saving device that you need first in order to care for somebody else. Now, I'd like to tell you that these respite grants are going to be used to give the caregivers some leisure time to go out and stop and smell the roses. That's probably not what the person's going to do with it. I myself, I don't have, I'm not caring for someone with Alzheimer's, but I do have a 20-year-old at home with spina bifida and does require a lot of personal care, and I am a caregiver. And I can tell you that I've used a respite grant. And when I've used the respite grant, I've used it to go to my own doctor's appointment so that I didn't have to bring her. I've used it to go to a meeting. I'm sure many people will use these respite grants to get a nap so that they are a little bit more awake and can care for someone. This is a small step. We need to do even more than this because I'd like to get it to the point where the caregiver can take that time out. That there are more resources so that the caregiver can have time to stop and smell the roses, because I feel that that does a lot to that person's mental health. And if they are in a better frame of mind, they will be able to take care of that loved one even more. So this is a stepping stone, one that we're going to celebrate, and we are glad that we're here, but we're not going to stop here. We are meeting with this committee, and we have a lot of enthusiasm, and we're gonna improve it even more. Thank you.
Thank you, Representative Mayberry and Senator Hill. We appreciate your support. You're great partners and making a tremendous difference today. So thank you. With that, we'd like to go ahead and open it up to questions. We're going to start with folks in the room. I do have a microphone to say the question into so the folks on the Zoom can hear. But let's start in the room. Do we have any questions here in person? One down front.
Yeah, I'm Daniel Breen with KUAR. Is this, I don't know who to direct this question to, is this grant just for respite care in the home, or is it to have the person go to a facility?
So these funds can be used to pay someone that the caregiver or the family knows personally. So anyone that's over the age of 18 that doesn't already live in the home, or they can use the funds to pay for a professional caregiver to come into the home. They can also utilize an adult daycare facility or a short-term stay facility. So really it's up to the family and which option works best for them and their loved ones.
Any other questions in the room? Seeing none, do we have any questions on the Zoom? If you would just go ahead and unmute and speak it. We'll hear you. We're allowing talk right now.
Hi, this is Remington Miller from the Arkansas Democrat Gazette. I just wanted confirmation on how often people can apply again.
Family caregivers can apply up to twice a year with 6 months in between applications.
Any other questions in the Zoom? Oh, I do see we have a question in the chat that this is being recorded. Will it be available? Yes, we will post this on the DHS Facebook page. All right. Any other questions? All right. With that, thank you all for being here. We appreciate it. Oh, we have one more question. When will the application be available? Is in the chat.
We will have the applications available shortly. Everything's kind of ready to go. We'll make an announcement on through different social media outlets, and it'll be available on our website shortly.
All right. Any other final questions before we close? Seeing none and hearing none, we'll go ahead and end this news conference. Thank you all for being here. We really appreciate your coverage.